Do you feel comfortable that you're going to do it correctly?
Yeah.
You got this?
anything on me.
Yeah, I got this. Except for the last time. Hi everyone, so we are doing a bunch of Botox today, and one thing that, a lot of people don't seem to understand is how Botox is manipulated and how it's used all over the body, all over the face really, to get that effect. So what are we going to do to help Stefanie's jaw? She has a little bit of fullness in the jaw here. More importantly, she's having pain from her temporomandibular joint, or the TMJ. The reason for that is there is a muscle here called the masseter muscle. The muscle hooks onto the bottom of the jaw at the angle of the jaw, and it goes all the way up to here to that. There's a zygomatic arch. It's a bone that goes all the way across here, and it helps you pull your jaw up. You see it, some people have really prominent jaws back here, and some of it is the bone, but a lot of it is actually that muscle that's super bulky. That bulkiness may have no real consequence, but for some people, even if it's not bulky, it can cause a lot of pain because of that extreme pressure that it pulls up on. So what we do is put a little Botox in here to just relax the muscle a little bit, and it helps to both make the muscle calm down a little bit, just not pull as hard. And it also causes a little bit of atrophy of the muscle. It sort of just slims the muscle down. So it has the added benefit of just slimming the face down and making it less wide at the jaw.
So some of my friends are interested in doing this treatment as well. Will this affect their smile? Because that's what everyone's concerned about.
It's actually a great question. Fortunately, this muscle is pretty far back, and there's not a lot of, there aren't a lot of competing muscles in that area, so the chance of it really affecting their smile is pretty minimal. I do 3 injections, 1, 2, and 3. So I keep it localized here, and because of that, I like to use a more concentrated Botox that, will keep it exactly where I want it to be. So the nice thing about this treatment, and again, this speaks to how little the complications are, is that you can do it even if you don't have TMJ. You can do it for purely cosmetic purposes. And I would say that is actually what happens in the majority of patients who I do this for in their masseters. They just feel that their muscle's a little too bulky and they want it to be slimmed down. It's perfect use for that. What I'm doing by grabbing over here is I physically can feel the borders of the muscle, and this helps me know exactly where I want to put the Botox in, so it goes right in the muscle and nowhere else.
So it's been 2 weeks post-treatment. You can see my muscle is relaxed and I'm no longer waking up with jaw pain.
For Melissa, we are going to work on her chin. Now, why? What's the problem?
I have a very active chin, and so for me, I really want to preserve a very smooth appearance and not have that orange peel look
There you go.
like old ladies have.
We're not going to let you do that. So the reason why it looks that way is there's a muscle down here called the mentalis muscle. Lifts up the chin, and it's actually important because, go and relax, it does keep the chin sort of in a nice upward youthful appearance. If you notice, some people as they age, their chin tends to drop a little, and Melissa has such a beautiful strong chin. It's never happening, but she does have that very strong muscle there, and what we're going to do is relax it, so when she does that movement, it's not going to be quite as strong.
My concerns are based off of having the orange peel chin. So primarily I just want to relax the muscles.
Good.
So I shouldn't be concerned that it's going to mess up my smile.
It's a great concern. It's a really important concern. The answer is if you do this correctly, it will have no effect on your smile. And the key there is you got to do it correctly.
Great.
So here's an interesting question. What happens if you have a beautiful patient like this who has a very nice smile, very full lips, but when she has a very, very big smile, look what happens. See how you can see all of her gums and her lip actually shrinks down significantly. So what I'm going to do is put some Botox here, here, and here to help relax the muscles of her upper lip and help sort of tame that smile a little bit. Why are we doing it? How does the Botox work? Everyone has some muscles that start up here in the nose, they work their way down the side of the nose here and land in the face, and they are the muscles of facial expression. They land here at the lip, and they help lift up the lip, they help you smile, they help you talk. In some cases, for some people, they work a little too hard. They pull up a little too high, and they do it in a way that, you know, some feel is not the way they want their smile to be. Now, that's not to say there is anything wrong with her beautiful smile. She sees a little too much gum when she smiles and would like to calm it down. It's so easy. I mean, literally 3 drops of Botox and done deal. The reason why I say that's easy is that we were actually just talking about one of her friends who had a similar situation. And because the friend felt that there was too much gum showing during her smile, she underwent a pretty intense dental procedure to cut out the gum on the top aspect of her teeth to try to make her teeth show more. Do you have any questions for me about this procedure or anything about it?
How often should I do the procedure?
I love that. Good question. Okay, so here's the timeline. We do the Botox. It usually starts kicking in about 3 to 5 days, sometimes more, sometimes less. Its peak effect is usually at about 2 weeks, and it tends to last between 3 and 5 months. So just go ahead and lay your head back. Start right there. Easy, right?
Yes, very easy.
For Kelly, our favorite office manager, today we're going to do her bunny lines with Botox. You can see that. Do it again. So this goes in line with everything I was talking about on so much of the face. There are muscles that pull. Usually there's a connection between bone and skin, and that is what allows us to make gestures with our faces, and it allows us to move the muscles the way we need to. What we're going to do is just put some Botox here and here to help relax this muscle that pulls everything up. Kelly, what questions do you have for me? Because Kelly had a very specific concern about this Botox treatment.
Is it gonna make me go blind?
You are not gonna go blind.
Wonderful.
Stop it, okay?
Not even a little bit?
Not a little bit,
So
stop
close
it.
to my eyes.
It is not going to go near your eyes. There is skin, muscle, bone, more bone, fat, other stuff before anything that's gonna hit your eyes. So no, you're not gonna go blind. All this does is it does relax this. And it's really important because, you know, there are a lot of people, you start looking around at it, you'll just see that after a while they have these resting wrinkles in their nose. You know, this can help prevent that, which is what we want. This is the area of the nose. When you squint, please, you can see the muscle just pulls up. So I do 1, 2, and it just relaxes that muscle. Okay. All right, Kelly, I know you're a little nervous about this. How do you feel now? Are you okay?
Doing great. I feel
Good.
not blind at all.
Being not blind is fantastic.
I'll take it.
This is gonna relax substantially. I think you're gonna still actually have a little bit of motion there because your muscles are really, really strong, but it's gonna soften it a lot. You know, you work out, I know.
Only my nose muscles. Oh, that sounds like a cocaine joke.
Botox is great. Botox can help slow down the aging process. Botox can help reverse the aging process. And Botox can help change certain features of your face and your body to a way that you may want them to be. There's a lot we can do with it. And what's great is that, you know, we're coming up with new things to do with it every single day. Thanks for watching my video. I really enjoyed talking to you about Botox and all the great stuff it can do. If you like the video and want to see more of what I do every day in my office, feel free to subscribe. If you have any questions, leave them down in the comments below. I look forward to talking to you more about this in the future.